Pregnant people in Ontario soon able to get their COVID-19 vaccine. The province has moved pregnancy to the highest risk category in its Phase 2, a change effective today. Now, the majority of health units are vaccinating people in the highest risk and high risk categories right now, and pregnancy was originally in the third tier of the at-risk category. That would have meant shots coming sometime in mid-May, so this bumps it up. And our next guest has certainly applauded that decision. Dr. Isaac Bogash is an infectious diseases specialist at Toronto General Hospital, a member of Ontario's COVID-19 task force. He's usually with us on Tuesdays, but based on your Twitter feed, I thought we better have a bonus visit about this specifically. Hi, Dr. Bogash.
Great to see you. Good morning.
When you were talking about this online, you tweeted, "It's the right move." Why?
Several reasons. One is that we know that pregnant individuals can have more severe outcomes from this infection, and you don't have to look too hard to see that in Ontario and elsewhere in Canada. We're admitting pregnant people to the hospital. Pregnant people are admitted in the ICUs. We've had some, for lack of a better word, very poor outcomes that are unfortunate and preventable. Emergency C-sections in the ICUs and whatnot. It's awful. So,
are you seeing that at your hospital? Are you seeing that in your hospital?
Across the street. Sinai is the high-risk pregnancy unit, and they certainly have a lot of pregnant individuals admitted in their ICU. I'm across the street at Toronto General. We have pregnant individuals admitted to the wards, and you're seeing this across the province. So that's a big deal. The second important issue is that there's emerging data that truly demonstrates safety of the vaccines in pregnant individuals. And of course, never before in Canada have we seen this much COVID-19. So I think this is a smart move. It really enables pregnant individuals to make decisions for themselves and to be vaccinated in priority if they would like. And I think it's a great idea.
Can we look at each of the things that you raised in a little bit more detail? Lots of research looking at pregnant individuals and why they might be at the higher risk based on what you're saying. You're seeing, and we're seeing around the world, the people who are sicker, who are dying, and the babies, too, it seems, at risk of neonatal complications. Is it something that happens when the body changes in pregnancy, Dr. Bogash? Do we know why this might be occurring?
Yeah. I mean, I'm not saying COVID's the flu, but all I'm saying is we see this with other infections as well. So it's not unique to COVID-19. While there are many unique features of COVID-19, severe illness in pregnancy is not unique to COVID-19. And there's a couple of reasons. One is there's some immunologic changes during pregnancy that sadly predispose people to infection. The other issue, too, is that you've got a uterus that is now enlarging, that can push up on the lungs, and the breathing can be impacted by that, especially at a time if you've got an infection in the lungs and you need every square centimeter of lung capacity possible. So there's a couple of reasons why pregnant individuals just don't fare as well with severe respiratory viruses.
That is really interesting. I haven't heard that explanation in that detail. The Canadian numbers show that more than 4,500 cases right now in pregnancy. So they're starting to get a really full picture of how this is affecting pregnant women, pregnant individuals. The safety issue that you raised, because that remains one that we get asked about all the time. Is it safe to be vaccinated if you're pregnant?
So it's important to recognize that the initial clinical trials did not enroll pregnant individuals. They didn't. And that's not just COVID-19. That's an issue with lots of clinical trials, unfortunately. And that's a problem because we need to know what to do with pregnant individuals. We need to see those safety signals. Since those clinical trials were done, there's been large registry trials that have opened up that have enrolled a ton of pregnant individuals. And in fact, some prospective clinical trials have opened up as well. A couple of days ago, it was published in the New England Journal of Medicine, one of the best medical journals in the world, a study outlining the early data demonstrating the safety of vaccination in pregnant individuals. So, sure, we don't have a full picture of all the data yet, but the early data demonstrates no concerning safety signals with the vaccines in pregnancy. So that's good news. Having said that, data is helpful and important. But I think it's also important to put this in perspective, right? You've got a potentially lethal infection. You've got a vulnerable population. You've got more COVID in Canada than ever before. At least give people priority and the opportunity to make decisions for themselves. to be vaccinated, to protect themselves and protect their unborn child. And that's what Ontario and actually New Brunswick have done. They have prioritized pregnant individuals. Like, it's the moral and ethical thing to do.
And again, is it any type of vaccination would be considered safe at this point, whatever would be offered?
Well, so just to be totally transparent, the study that was done in the New England Journal of Medicine looked at the mRNA vaccine. So it just looked at the Pfizer and the Moderna vaccine. I have to look to see, just full disclosure, I have to look to see if there's any good data for AstraZeneca.
Okay.
I just don't have that information at my fingertips. But again, as long as people have the ability to make decisions for themselves, I think we're in the right place. And of course, we can contextualize benefit and risk at an individual level, and pregnant people can speak with their primary care provider or their provider that's helping them through their pregnancy to really help make a decision that's right for them.
But again, in Canada, AstraZeneca is now 40 plus in most provinces, 45 in Quebec. So that might not be for the majority of pregnant individuals. So the others younger would be receiving the other two that you mentioned. But it's important to consider all of these things. And from what I understand, public health units will have the information, and there might be spots as early as this weekend. So appointments opening up as we speak.
Fantastic news. Fantastic.
Thank you, Dr. Bogash. As always, we appreciate that expertise.